Today, we were partnering with Zuri Nzilani Foundation and Still a Mom, and we were doing respectful bereavement care for medical professionals. And the experience has been nothing short of mind-blowing. So we had nurses, medical officers, just a wide range of professionals. And part of the feedback is that we needed this like yesterday. We've had many of them have aha moments about self-care, how to communicate to bereaved parents, what to say, what not to say. And for me, I think that's the highlights. Just seeing a medical professional say, I know I'll give different care, which is better because I came. So I think that's the highlight for me, just seeing the change of mindsets from what people are able to do and the care they're able to give.
When you look at our statistics, especially from Kenyatta National Hospital, most of the mothers die out of this condition. So from understanding this, it is good you also involve us as the gynecologist, so we can also be part of you people to talk to the community, to enlighten mothers, and by that we will be having the community level of preventing the bad outcomes, especially of the preterm babies dying and all that, because we can prevent the complicated part of it from the ground. It's like you people, you're acting like community health workers. That is amazing and that is so nice. I'm so happy.
When you talk about loss, it really hits on us. Us working with the mothers and the babies, it becomes a bit more overwhelming. My worst incident was that there's a mother who came in with severe eclampsia at 28 weeks. The mother had to go to the theater as an emergency, and from there she went to the ICU. And the baby definitely came to the NICU. There's a dad here who was called from work, came to find the mother being in ICU. Unfortunately, the mother didn't make it. So when he came to see the baby in NICU, he was like asking the baby, you are the one who has taken away my wife. He started to say to you that this baby passed on 2 days after those talks. It was really touching.
I really hope that the training that we've undergone today, or we've gone through today, will also get to many more healthcare professionals to be able even to know how to handle better bereavement issues, especially to mothers who have lost their young ones.
I think as a medical specialist, this kind of training should be inculcated into our medical school curriculum, because most of the times you find that when you go to hospitals, whenever there is a bereavement, most of the time you'll find it's only the nurses who are left to break the news to the patients, and the doctors are nowhere to be seen. So I think if it's inculcated into our curriculum right away from the undergraduate, it will give more confidence to doctors to be present whenever there is that breaking of news to patients, and it will also increase the confidence of patients that they'll actually feel that they're cared for, as opposed to the current scenario whereby you find not the whole team is present and some take off, not because they want to, or I think it's because sometimes they lack the knowledge of how they are going to present the news to the patient and to the relatives at large.
I think that it's very important for doctors, nurses, or healthcare workers, or any member in the hospital who takes part in the care of the patient to go through the grief and bereavement training, as it helps with the mother going through some stages of loss that they will have differently for every patient. So it's important for everyone to just know how each patient presents themselves and how you can take them through the process of loss. Yeah.
So from the training, I've learned so much. I've learned on what to say, what not to say to a bereaved parent, and how to handle a parent who has been bereaved before and has given birth again.
This is not part of school training. Like when they are being trained, no one imagines that you'll have to deal with grief. It's probably just something that they have to walk on the waters and figure out. So just to see that this is not something that's offered in their education or curriculums, and coming in for them how they are so overwhelmed and thinking, oh my gosh, no one trained me for this, I'm having to learn it by myself. It's a bit shocking, but also we can imagine that as we come in with Zuri Nzilani and partnerships like with Still a Mom, trying to break that barrier and become the bridge between educating them that this is a valid concern. First of all, validating that we hear you, we see the gaps, and we want to be that bridge.
Our thank yous can never be enough for the work that you do. It is immense, it is intense, but we celebrate you. And I know as a society, we don't do that enough. So let me take this time to say thank you. Thank you for the early mornings. Thank you for the early mornings, the late nights. Thank you for at times getting into your own personal and interrupting your own personal programs for other people who you're honestly not even related to. But that you pour yourselves daily pouring yourselves.
If you feel you would want to work with us, you want to help us in amplifying our voices, because no woman should die because of preventable issues. We can prevent the death of these women if they only get the knowledge that we are trying to put out. This year, between 2023 and 2024, we've had 43 successful births, all accredited to education. These are women, 90% who had lost children because of severe hypertension. But because of the education and support we give in our group, 43 of them gave birth successfully. It was preterm. Even if it was preterm, it was successful. They went to hospital on time. And a lot of women don't go to hospital on time. They come in when really, as a medic, there's nothing you can do. And we acknowledge that. So from the bottom of my heart, I really want to say thank you.